That's a little too much for me, and I get nervous when any of my patients take 3 or more grams per day. Hey guys, welcome back to my channel. Today we're going to talk about Tylenol. Ever take one more Tylenol because that headache won't quit? For most healthy adults, the absolute ceiling is 4 grams or 4,000 milligrams per day. But many people need fewer than that, either 3 or 2. Today we're going to cover Tylenol, side effects, what it's meant for, pregnancy, breastfeeding concerns, liver and kidney problems, and common drug interactions. Hey guys, before we go on, please drop me a thumbs up and hit the subscribe for those who haven't. And I'm here to make medicine make sense. So let's jump in. Acetaminophen, the brand name is Tylenol, is a non-opioid analgesic and an antipyretic. It lowers the fever, but it doesn't reduce the inflammation. It works in the central nervous system and the hypothalamus. The hypothalamus is that part of the brain that helps regulate temperature, hunger, thirst, sleep, stress hormones, and reproduction. Now, Tylenol works fast and causes minimal stomach side effects. When it's dosed correctly, it's safe for many people. The risk we worry about is liver toxicity if you take too much, take it too long, or combine it with another drug product without realizing it. So let's get into the adult dosing basics. Let's translate labels into actual real life. A regular strength is referring to 325 milligram tablet, and the typical dose is 2 tablets, which is a total of 650 every 4 to 6 hours. Extra strength is usually 500, and we double up with a gram or 1,000 milligrams every 6 to 8 hours as needed. Then we have extended release, which is very rare. It's 1,300 milligram tablets every 8 hours as needed. The tablets are actually 650 milligrams, and 2 of them are taken together. Now, it's very important to understand that these high doses of extra strength and every 6 to 8 hours are not meant to be taken continuously. The manufacturer will tell you that regular strength can be taken of up to 3.25 grams per day. That's 10 tablets. But that's a little too much for me. And I get nervous when any of my patients take 3 or more grams per day. So usually what I tell them is this is highly dependent on your risk factors and other medicines that you're taking. Now, acetaminophen is very common in cold preparations and flu combo pills. It may be linked with Benadryl or a cough suppressant or a cough mucolytic. Other names for acetaminophen include APAP, paracetamol, and what you need to do is you need to add up the entire dosage to find out what you're getting. Now, a healthy adult may be able to take up 4 grams per day, and that's what you're going to read in the package. But in high-risk situations that we're going to discuss include alcohol use, which can include binging or more than 1 drink for women per day or more than 2 drinks for men per day. Risk factors including malnutrition, a chronic fasting state, low body weight, a febrile form of illness, certain liver diseases, or other interacting drugs. Special situations and risk factors do increase the risk of liver damage, and this can be seen with even low doses of Tylenol. Usually people with liver disease will be counseled to not take anything more than 1 gram per day. For people who are fasting or of low weight, their liver uses less glutathione, which is an important chemical for metabolizing the Tylenol, so you want to use smaller doses. The elderly relatives, they are more vulnerable. They want to take the Tylenol for pain management, and that's fine. But we also ensure that they try to take smaller doses or for a smaller amount of time. Now, the good news is that for patients that have kidney disease, Tylenol is okay and safe for a short course. But anyone with dialysis or really advanced kidney disease, they need to be very careful with Tylenol because hemodialysis will actually remove some of the acetaminophen through the machine. And so you want to consult with your nephrologist and see what they say. For liver disease, we classify Child-Pugh class scoring, and the Child-Pugh class score is a system that doctors use to determine how severe a patient's chronic liver disease is. We have 3 scores of A, B, and C. In A, if they're not actively drinking, then short-term use is appropriate and can approach up to 4 grams per day. But Child-Pugh class B, if you're not drinking, your limit's lower at 3 grams per day. And then finally C, the limit is the lowest at 2 grams per day. We have IV routes, we've got rectal routes. I've rarely used IV, but it is available. They're usually more commonly available in a hospital or a clinical setting. The doses are similar. I am familiar with rectal doses because sometimes when the patient is unable to safely swallow, such as in settings of a stroke, the rectal is the only absorption and only means we have to give this medication. For pregnancy and breastfeeding, acetaminophen is commonly used in pregnancy, and at the lowest effective dose does appear to be safe. It also appears in breast milk in small amounts, but if you are using a high dose, you need to consult with your obstetrician, your gynecologist, or even your pediatrician to see if it's safe. Drug-drug interactions. Warfarin, also known as Coumadin, which is a common blood thinner, can actually thin the blood even more in the setting of concomitant Tylenol use. Tylenol and warfarin together can prolong that INR. For those who use warfarin, they get their lab test checked and the INR can get too high, which can cause the patient to bleed. So this is very important. Other drugs include rifampin, INH. There's certain seizure medications like phenytoin, carbamazepine, phenobarbital, or phenobarb for short, can increase the risk of liver. Alcohol, we already know, can raise your liver risk. Then we've got phenylephrine and other medications as well. In terms of vaccines, you don't want to take the Tylenol before the vaccine to try to help manage the low-grade fever, but Tylenol after the vaccine is safe. Now, side effects include rare rashes. Then we've got nausea, headache, insomnia, which is very mild, but was noted with the IV formulation. And we have mild GI symptoms. Some rare but serious side effects include skin conditions such as Stevens-Johnson's or toxic epidermal necrolysis. These are really critical. And what happens is the skin rash that develops is severe, it's diffuse, it's sometimes in the mouth, it's all over the genitals, it's just all over the body, and the skin is sloughing off. It is a life-threatening emergency and needs to be managed in the hospital. Your key takeaways. Find acetaminophen, APAP, or paracetamol in every product. Add up all the milligram dosage you take in a day and ensure that it is at least less than 3 to 4 grams per day. Avoid using more frequently than every 6 hours. Avoid using for a long period of time. And if you are at higher risk because of the alcohol drinking, the low body weight, then try to limit to 2 grams per day. Tylenol is safe when used chronically. If you like this video, give me a thumbs up and subscribe. I'm here to make medicine make sense.